Thankfully now there is a gene therapy, but many boys with ALD still face many severe challenges, and the disease is still often terminal. Family planning and access to family planning has been a really big part of my life. Growing up, I felt very secure knowing that one day I could eventually pursue avenues and have a child that is not impacted by ALD, and that really helped with my psychological adjustment going into adulthood, knowing that if I choose, I can still be a mother and I can have a child that won't have this terminal genetic condition. So this topic is really important to me. I'm also the founder of Remember the Girls, which is a nonprofit organization dedicated to helping females that are impacted by X-linked conditions. Thanks.
Thank you.
Yeah, hi. My name is Esmeralda. I have a bleeding disorder, Glanzmann thrombasthenia. It's ultra rare, so it can be extremely lonely. Sometimes we are 1 in every million births. Wow. It's a platelet coagulation disorder. I'm very passionate about women's health and reproduction. I want other women with my diagnosis not to experience and live through what I did. I know science is changing, things are changing, but I want to avoid that. In the bleeding disorder community, we're just starting to talk about bleeding, right? I mean, saying menstrual cycle, right? We're still a little behind on talking about sex. I haven't heard that word in our community, but we're catching up. I think women are raising their voices. There's a lot of, it's the trend right now. We're trending, women with bleeding disorders is a trend. But I'm very passionate. I'm also very passionate about the intersection of culture, policy, and health equity, and how that kind of affects our healthcare outcomes, our quality of life. So I'm very happy to share my experiences and to hear with my panelists and all of you. Thank you.
Thank you so much. And as was shared, I'm Dr. Michelle Fynan. I'm a clinical sexologist. So that means that I'm a sex therapist, and I specialize in working with people with chronic illnesses and disabilities, discussing medical trauma a lot of the times, and talking about how we are sexual beings in spite of rare, ultra rare, or just even chronic illness. And so again, just it's so important that we are having this conversation, and thank you to NORD for having this on the docket for today. So we had each person shared a bit about their specific rare disease. I have osteogenesis imperfecta, which is a brittle bone disease. Not only do I have it, but so do both of my daughters, and they are 9 and 6. And so that really has kind of lit that fire in order to be advocating for sexual health and reproductive conversations in our community. So I would like to kind of shift into that talk of having the conversation when it comes to healthcare. So I'll start with you, Andre, again. What's your experience been in talking with healthcare providers about your specific sexual health concerns? And have they been knowledgeable? Has it been supportive? Have these conversations even happened?
Yeah. I think that's a very good question. I want to preface it and say, I think Esmeralda alluded to it earlier about culture. And we can't have these conversations without knowing about culture. And so culturally, I was raised in a very, I was around very religious home. I was raised in the black church, I guess you could say, most of my life, very in like a Pentecostal sect, so like everything sent you to hell, right? So of course you can't talk about sex. That was a no. So of course that kind of shapes how I present, right? And so there was never a time, oh my God, like my doctor would say, "Are you sexually active?" No, lying through my teeth. But I just couldn't bear to admit that because of my culture. But fast forwarding now, as I got into my 30s and I've kind of, been comfortable with being open and honest about sexuality and sexual health, the answer to that question is yes. And what do I need to do? How can you support me to make sure that I'm staying safe with the fact, knowing that I have a chronic disease, a rare disease, and I don't want anything that could further exacerbate the presentation of my disease. So that being said, as someone who is queer, it's also important to understand things that you need to be aware of or know when it comes to your sexual health. So I don't know I'll ask this question. How many in this room know what PrEP is? Raise your hand. Okay, that's
Good.
more than I really thought it would be, because usually it's one person. And so I bring that up to say, like, a lot of people with sickle cell go to comprehensive sickle cell centers, and the people that take care of us are hematologists, and they may have a PCP or a general practitioner that only sees sickle cell patients. And so I go into the clinic one day and I asked the PCP at my sickle cell clinic, hey, I'm interested in PrEP, I want to get on it. And she said, what are you prepping for? And I was like, oh, wow, okay, have a great day. And I found another PCP because they didn't know. And I kind of gave her the information. She was like, I've never heard of this before. So that being said, I think this is why these conversations are important, because it's not an indictment to the medical industry. I don't believe every doctor needs to know or can know everything.
Right.
But also, as someone who has these needs, you do need to know where you need to go to get the needs that you have taken care of. And so, yeah, to succinctly answer that question, those conversations didn't happen, and then when they did, the knowledge base wasn't there. And so now recently I've been able to find a PCP who knew about PrEP and could tell me, because you have sickle cell, you should be on this type of PrEP and not that type of PrEP, because people with sickle cell have kids. So this is why this is important, because if they know that because of your disease you need to be on something else, we need to know that.
Wonderfully said. And for those who didn't put their hand up for knowing what that
I
is,
should have
can you
explained
share
it.
a little
Sorry.
bit? Because, and I think that that's so important, because so many people may be at the very beginning stages, and so go ahead and let
So
let the people know.
also, I do sickle cell work, but in my PhD program, I'm a research assistant at a HIV/AIDS research center. And so I've been like thrown in head first in HIV/AIDS research. So, but I knew what PrEP was before that. PrEP is what you can take to reduce your risk of contracting HIV through sexual intercourse. So PrEP has been found to be very effective in certain populations, many of them being LGBTQ plus populations. And so many times they will prescribe you PrEP to take every day to mitigate your risk of contracting HIV. And so it's a wonderful tool to reduce the risk of HIV spreading. But also recently there is a lot of data that shows that there are a lot of different populations outside of LGBTQ people that should be on PrEP, but the focus has been on LGBTQ plus. So that's why I'm glad you said that. More people need to know what PrEP is, because it may be beneficial for you. So yeah, definitely Google PrEP and have that conversation with your doctor if you think that's something that is right for you.
Beautiful, Andre. Thank you so much. And Taylor, in what ways do you feel the healthcare system, when it comes to this topic, has, really left a hole there in being able to talk about this conversation with those of us who have rare diseases?
Definitely. So this also ties into the last question, but growing up, basically everything I learned about sexual and reproductive health in terms of being a carrier of ALD came from my mom, who thankfully or not so thankfully is in this room right now. But even before I think I started menstruating, she said to me, you're a carrier of this condition. If you get pregnant, it's a different story than for someone, who's not a carrier of this terminal genetic condition. Thankfully, she took me to a genetic counselor when I was a teenager, but gosh, every doctor I've seen, whether it's my primary care doctor or my OBGYN, when I've said I'm a carrier of this condition, there's just been blank stares. And I don't expect them, as Andre, you said, I don't expect them to know what ALD is, but I would have expected, especially from an OBGYN, and especially now that I'm almost 26, there to be more of a discussion about having kids when I mention I carry a genetic disease. And it seems like there's a really massive disconnect between OBGYNs and genetic counseling. And thankfully, I know all the options, and one day I plan to do IVF with PGT. But I've had to find out a lot of that information, well, through my mom, and then as I got older, through myself. So there are really, really major gaps, and I worry for other young women who are carriers of genetic conditions who aren't getting this information, and, you know, likely they're not seeing a genetic counselor, but a lot of us are seeing an OBGYN, you know, to get birth control, to get a pap smear, and these conversations are just not happening. So there's so much to be done in terms of helping educate young women, young men, people of all ages about family planning options. And I think one way to start is by having these conversations and having organizations like Remember the Girls that really tries to raise awareness of these topics, not just among rare disease specialists, but the general healthcare profession as well.
Beautifully said. And I just want to also shout out to Mom for having that discussion, because as a parent, I know that this can be an awkward conversation if we allow it to be, especially depending upon how you were raised. You mentioned, Andre, how much religion can really impact the way we view sex in general. And so I want to say, for the parents that are in the room who may be bracing themselves to have these conversations, just how important it is to do so. And that's coming from someone who, I'm a sex therapist, and I am already kind of like, ooh, I'm a little nervous about having those conversations. So it's not just about your education on the topic. And so if you are finding yourself in that position and you're wanting some support, just know that there are people out there who can certainly provide support in that. I know all of us here on this panel, we want all of you to know that you can approach us after this discussion, reach out to us. There are sex therapists, more of me, who focus on chronic illness and disability, and so those discussions need to be had. And so thank you. Esmeralda, have you, when we're talking about these barriers, have you faced any specific barriers when it comes to healthcare provider experience and your own sexual health with a rare disease and even access to care?
Yeah. So with Glanzmann's thrombasthenia is an autosomal recessive diagnosis, and there's a very high risk of maternal death at labor. And I knew that growing up, and I remember my parents having that conversation with doctors with me in the room, assuming that I didn't know what was happening. So I always grew up knowing that I was most likely never going to be able to have children. So I always knew, it wasn't a shock to me as I got older. But medicine changed, right? And things started, research, and when I started talking to my hematologist, he's like, absolutely, like women with Glanzmann's can have children. So the barrier that I encountered is that to really see a specialist, like a maternal fetal medicine doctor, you need good insurance. You need a nice PPO, right? And I have Northwestern in my back door, but I couldn't access Northwestern with my cheapy HMO plan, right? But so I had to switch plans, access that doctor, and then I started realizing that we have so many specialists who just look at their little specialty. So they're only looking at my well-being in maternal health. My hematologist is looking at bleeding. OBGYN is looking at my female parts, right? Who's putting it all together? And that's where my frustration was, because my hematologist was like, you can have children. The fetal medicine specialist, absolutely not. He's like, you have a very high risk. And that's where everything started falling apart for me. Like, nobody can tell me like how to go about it. I eventually decided that I was not gonna go ahead and try family planning just because of the high risk of maternal health. And that's one of the issues also with ultra rare. There's no research out there. I had access to PubMed. I'm Googling my diagnosis. There's no research on a lot of women who have given a successful birth when I was in my 20s. So I just kind of made that decision, like no children. But it was really frustrating, like accessing the specialists, dealing with the insurance barriers. me connecting all my specialists together, because everybody's just looking at their own little specialty, and that's when the barrier came. And that's the when I talk to younger women with my diagnosis, that's kind of my main focus, how to put everything together and show them and let them know that there's options for them out there.
Wonderfully said, how when you're dealing with ultra rare and rare disease, sometimes we are the ones doing the thing for the first time. We don't always have that visual example of what's safe and what isn't, and we may be getting different messages from healthcare professionals.
And then you're rare when you go see a doctor and they're like Googling the diagnosis.
Yes.
You know?
Yes, and I'm sure.
How do you spell that? Glansmans?
Yes, and I'm sure that's a shared experience that we can have. And I'm seeing the heads nodding in this room, and that's the beautiful thing about being able to come to these types of conferences, right? And so with that said, how important, and we'll come back this way to you, Andre, how important have patient support groups then been, and these different networks that you're a part of, how important have they been in helping you address some of these unique concerns with sexual health?
That's a good question, and I want to shout out one of my fellow patient advocates. Her name is Tiana Wolford, but she founded, I'm going to get the name of her, what is it, Gina? Sickle Red? SC Red. But basically it's focusing on people with sickle cell and reproductive and sexual health concerns, much like what we're talking about today. But so I say that to say a lot of us in the community have these conversations, like for women who live with sickle cell disease, a lot of times participating in sexual activity will be a precipitator of them having what we call a sickle cell crisis or a flare, however you term it in your community, you know, just an exacerbation where we need to go to the hospital or we need pain medication. And so a lot of times, a lot of women with sickle cell just avoid or not have sex at all because they don't want to get sick behind it, right? Or with men, we have, as I said before, I'm writing my dissertation on priapism, and so the same with men is we have unwanted erections so that are painful. It's not just that it's an unwanted erection, they're painful, and they can be very life-altering and life-changing. So we have these conversations within our groups, but it kind of stays there. It doesn't really transcend out of our cliques, our groups, and we really need more of the outside conversation because, again, if our providers aren't talking about it, if we're really not hearing it from our organizations, the stakeholders in pharma or biotech that may be able to create a therapy or intervention to prevent it or reduce it, then what's happening, you know? So that means a lot of people are not having sex, and some people say, okay, that's fine, you don't need to have sex to live, but let's be real, people are having sex, right? They want to have sex, and I think that's part of one of the reasons why I decided to write my dissertation on priapism. I'm writing my dissertation on penises, right? So again, that's a little uncomfortable, right? But I thought it was important because we don't talk about penises and vaginas enough. I just have to say that. We're in a penis vagina.
Say
okay, we're good. So we don't talk about it enough. And if we don't talk about it, who's developing interventions to help us?
Right.
You know what I mean? And lastly, I'll say, I think it's really important because a lot of times for the rare disease population, but also like the disabled and chronic disease populations, we are asexualized. People, oh, you're not having sex. You're too sick. Are you silly? Like, well, someone can't continue to have sickle cell or whatever disease it is if they're not having sex, right? You know, like if no one was having sex, most of our diseases would be eradicated. Am I not?
Yeah.
Okay, so it doesn't make sense. So if you are assuming that we're not having sex because you think we're too sick or we're immobile or we're a paraplegic, quadriplegic, whatever it may be, that's why we need to talk about it, because we're having sex, we need help. We may need assistance, but we're having sex, and we should not be shamed for wanting to have sex. And I promise I'm gonna be quiet, but I think this is the part of it because, well, you shouldn't have sex because you have this disease. So you're being irresponsible because you know it may make you sick, or you're being irresponsible because you know if you have sex, you may get pregnant, and then you may reproduce with a child that's going to have the disease that you're living with, and you know it's a very, devastating disease. So
Right.
there's so much stigma and judgment when it comes to sex, period, but especially in this community. So we're having the conversation, but it's not where it should be.
Yeah.
Right.
Could I add something?
Absolutely. Yes.
No, clap
Yes.
to y'all.
What Andre said just made me think of an experience that I had. And I've been so glad to be able to meet so many other women with ALD, both that are around my age, who I can talk with about relationships and, fears in terms of eventually, say, having bladder and bowel dysfunction and that affecting sex. Obviously, if you're peeing yourself or pooping yourself, that will get in the way of sex. Yeah. But there's a lot of older women in my community who in their 50s, 60s, 70s, and they share tips about how to keep their husbands happy without having sexual intercourse. So they'll share tips on, someone called themselves the hand job queen, things like that. But basically, it's just really nice, to be able to have a group of women, and especially women who are older and who are experiencing, say, more severe symptoms that I'm not experiencing now, and seeing that they're still able to have these happy, fulfilling sexual relationships despite their symptoms. So, but like Andre said, these conversations are definitely happening behind closed doors, and our community is getting more open with it. But I think sexual dysfunction really comes to the core of our identity. I know that when I was younger, I thought, is there something wrong with me because, I can't have kids the normal way, or will there be something wrong with me one day if my bladder or bowel dysfunction gets in the way of sex? And obviously there's not, because,
Right.
it's just part of being rare. But having these conversations is so important, and it's great for people to share tips and advice, because we're not getting those tips from our doctors, obviously, so.
Right. Thank you both so much. I mean, what other, space can we say? Penis, vagina, pee, poop, and hand job queen. It's been a unique session so far, and I just appreciate the vulnerability of our panelists. With that, Esmeralda, I have a question for you about continuing this conversation, but through the lens of when we're entering into intimate relationships, and how has that experience been for you?
That was one of my hardest phases in my life. So another symptom of my diagnosis is that I have pretty significant bruising. I mean, bad bruising. Bad that DCFS would always call on my parents, assuming they were physically abusing me. So dating was always really hard. When you're young, it's always like love, right? Just the butterflies of love. And then I started transitioning into my 20s when I was more sexually active. And I wasn't ashamed of how my body physically looked, but I was truly ashamed of the bruising. How do I show that, right? And I would try to hide it as much as I could, but that was very difficult. And those were conversations that my parents never had with me. We never had that conversation about sex. It was always don't get pregnant, stay in school. And I was I'm on birth control. How am I ever going to get pregnant, right? And then as I started getting older, it got even more difficult, because now we're starting talking about child planning. Guys would say oh, when I'm a dad, I want to do this. And I'm sitting there oh, I don't know, what do I say now? And I had nobody to have these conversations with until I met you. When we were planning for this panel, and I was as growing up, my mom wouldn't talk about that. She didn't know what I was going through. I couldn't talk to my friends. They didn't know what I was going through. I knew nobody in Glansman's, so that was even more lonely. So it was and as I got older, I did eventually meet a wonderful man who called my little bruises nebulas, and I knew he was the one. And he was a wonderful man, but it's very difficult conversations to have when you're dating, and it changes as maturity level happens.
Absolutely. Thank you so much. So as we wind down and begin to shift into a Q&A space, I would love to hear from each person about what your hope for the future is when it comes to the discussion of sexual health and reproductive health for people with rare diseases. Andre?
I was maybe she's
See
going to
what
start back
happens
on
when
the
you
other
sit
side.
next to me?
Okay, well, So, and we discussed this before, so I'll just say it at this point. I think, as I alluded to earlier, the last couple of years, I've been appreciating how we've incorporated the LGBTQ perspective into the rare disease space, and that is part of this conversation. Because also when we talk about sex, if it happens, when it does happen, a lot of people have a very binary view of sex, and you are, it's very heteronormative, and that's also very naive.
Yep.
And so regardless of, the feelings about LGBTQ people, they exist. And they definitely exist within the rare disease community. And so having those conversations, I think, are important. So I'm grateful to see those happening, and I'll do that afterward. But we'll have one in a couple of days. But then also, I would love to see, as I said before, see more people interested in trying to find ways to assist us, right? Because I think a lot of times sex interventions are thought to be auxiliary. Like, that's not part of your overall health. Like, that's like an added benefit. And I guess because I'm nerding out writing a dissertation, really learning about how your sexual health determines and can be an indicator of your overall health, and vice versa, I think it's very important that there are more people in policy and advocacy spaces that are knowledgeable about sexual health and how to advocate. And then also, what are pharma and biotech doing? Because there has to be some type of way to treat priapism through a pharma or biotech intervention. It has to be. There has to be a way for medical professionals to advance the way they treat women with sickle cell who have sex-induced sickle cell crises. There has to be. So I think these conversations will lead to that.
Thank you, Andre. And I know before you were like, I'm sorry, I'll be quiet. Don't ever be quiet. And I don't even think you will. So I probably don't even have to say that. So, but thank you so much for sharing those pieces and your view of the hope for the future of this conversation. Taylor, what about you?
Something that I hope for the future is greater access to family planning options. Already, a lot of family planning options are really financially inaccessible. IVF with PGT is almost never covered by insurance and usually costs over $25,000. And now in certain states, it's not even available, period, which obviously affects people who are living with genetic conditions who want to pursue that option to not pass down a devastating or terminal condition. So unfortunately, it seems like access is decreasing, but that's why we need to continue having these conversations and think about policy and what we can do as a community to make sure that these options stay accessible, become more affordable, and that this topic isn't taboo, and that we understand, people are always going to do things differently. We might have one opinion on what we would do personally, and that could be totally different than what somebody else would do. But it's important to understand that we all come from different stories, so we need to respect that of each other. And then, just have more panels like this. I know we'll all be continuing this conversation for sure. So I think just really having these taboo conversations, and it's been great to see these raising over the years at these big conferences. So.
Absolutely. Thank you, Taylor. And for you, Esmeralda, I know that you had mentioned policy before. So as you share about your hope for the future, I'd love to know your thoughts on policy change as well.
Yeah, you know how mental health now is recognized as such an important component of our healthcare outcomes and our well-being. When I go to the doctor, they ask me do you have any sad days? How are you feeling? And that's a standard question now. They also ask are you married? Do you feel safe in your home? So my hope is that one day, hopefully very, very soon, they will ask how's your sex life going?
Yeah.
Do you need any how can we solve if there's any issues? I want that to be a normal question in our annual physical. And also ensuring that everybody has access to the insurance. And I know insurance kind of put a lot of barriers that everybody should see a specialist that they want, because it ultimately is not just our health outcomes, but our well-being and our happiness. and having a healthy sex life and being able to reproduce as we want is a huge component of it. And I think it needs to be valued a little bit more. And more panels like this and the conversation and saying all the words, vagina and penis
Yes.
and everything.
Yes, thank you so much. And, you mentioned, Andre said how physical health is, related to our sexual health, and talking about how it involves our happiness, and it also greatly impacts quality of life. And so I'm so glad that we were able to talk about this topic. And at this point, we'll go into Q&A.
So I just want to say first, this has been amazing. You guys are wonderful.
Thank you.
So we do have some NORD staff who can circulate here if anybody wants to write a question. You should have a couple of these little cards in your bag. We're a small group. We've become an intimate group.
Yes.
If you want to just stand up and ask a question or even come up here, that's fine too. Yes, it looks like we have a question here already.
I have a child with a rare disease who probably might not be able to get pregnant just due to the fact that her ovaries probably have damage from her rare disease. And so probably can't get pregnant, but if she were, obviously, there's a risk of passing it along too. But she's 9 right now. She talks about wanting to be a mom. How and when do I start that conversation, and how do you do that? I don't know.
Yeah, I can talk about this. As I said, my mom started talking to me about my family planning from a really young age, probably like 7 or 8 years old. And from what I remember, she told me that I can still be a mom if that's what I want to do, but that it's just going to look different than it will be for other people. And so, I think that explaining to your daughter just the many ways that you can be a mother, it's not just about getting pregnant and having a baby. There's adoption, there's surrogacy, which is obviously really expensive as well, but that there's many different ways to be a mother and to be a parent. I do think that growing up, at least for a couple years, or maybe until I met my boyfriend, that I was kind of adverse to having kids because I saw it as like, oh, I'm going to have to go through this big task to have kids. Probably now that I've been in a relationship for 5 years, my mind has changed on that a little bit. But, I still felt so much more secure knowing that there were options and that I could be a mother one day. So I think it's having these conversations now, especially assuming your daughter is probably a lot more mature than a normal 9-year-old, considering that she has a rare disease. And I think that starting early is actually better because, at least for me, I just grew up always knowing that I would eventually do something different than other people. So I can't ever remember a time where I learned it, basically. It's just been a part of me since I was a child. So I would say that I can definitely start the conversation now and in little bits over the years explain more and more. That's just my advice. Obviously, I'm not a genetic counselor or anything, but just based on my personal experience.
Thank you, Taylor. And I can speak to that as well. My oldest is 9 years old, and she likes to tell me that she's going to have 50 children. Jesus. So as a grandma, I'm preparing for that. But again, just having developmentally appropriate conversations about what motherhood could look like. And I would say for myself, at first, I also, in my experience with rare disease, didn't think that I would have children because I greatly feared passing it on to them. And I actually had so much healing from meeting my husband and him not thinking it would be that big of a death sentence in the way that I thought it would be. Of course, it's different for every rare disease. But for me, his perspective offered a lot of healing for me. And then just being a part of the OI community and seeing how other people navigated that really helped us to make that decision for ourselves. And I've had a lot of conversation with both of my girls who have the same disease and they've also given me healing in saying, oh, well, we love this about ourselves. And so it's just interesting to hear that perspective as far as being able to have children. Again, just normalizing the conversation and putting your children in rooms where they can talk about that with other people and hear from people who are a few years older than them too, can just be so supportive. So great question.
Sir, I think we have a question over here.
Can I say something in response to that?
Please do. There's so much knowledge in the audience as well, so I love that you're offering that. Thank you.
I also was from childhood told due to a condition with my ovaries that I would never be able to have genetic children. There's no, egg retrieval and planning for the future. It's just not an option. And I think as an adult, I'm in my early 30s now and still kind of working through aspects. I think my biggest advice to parents is obviously, as you said, the age appropriate kind of explanation, but also peer support at different intervals and across different ages of peers, of people who can relate to that situation, but different ages. So if you can connect with other parents who have children who also have a similar future trajectory, maybe not the same exact condition, but the same kind of reality ahead of them. And then I think also people are quick to put out the alternative options for family building, and I think having a sensitivity that while those options can be great and they can be fulfilling, that they're not necessarily readily available for people. Mm-hmm. They have high cost associated with them in certain ways, and to be honest, it's not the same. It's not to say that it's less than or not good. It's just, it's different than when it is a matter of, having children naturally that are genetically your own versus having to get past that being a barrier and being open to those other options. And I think just kind of doing more listening instead of just, here are your options. Because I was a minor when I was in my doctor's office, and I was pretty much bombarded not only with a diagnosis, but, there are other ways to become, a mom. There's this, there's that, blah, blah, blah. Okay, bye. So I don't want to hog the floor, but I just wanted to offer that to you. And I'm happy if you wanted to connect it all after the meeting. I'm happy to.
Thank you so
Thank
much.
you.
And
I think we have another question in the back here.
And as you're making your way back there with the mic, I want to say thank you so much for that part, and recognizing too that the rare disease experience has a lot of grief and loss within, the many different experiences that we have, and it's important to still maintain space for that.
Yeah, that's good.
This is going to be our last question.
So this isn't necessarily a question, but again, addressing your point. So I was diagnosed with tuberous sclerosis when I was about 8 years old. And I remember a lot of the medical community didn't have answers. I mean, the dermatologist that diagnosed me, he looked at my nose and he just immediately said, you have tuberous sclerosis, you're lucky you're not profoundly retarded, suffering from catastrophic, 8 years old to hear that, it's kind of a little scary. But, I remember it was like my mom had been looking into a crystal ball, because she said, at some point in your life, they're going to have genetic testing. They're going to have, the ability to change, your genetics so that you can actually modify it so you have a healthy child and such. Flash forward, 45 years, and again, that stuff wasn't even in the medical journals yet, right? And she kind of forecasted it. And it came true, right? So all that stuff's out there. In my particular case, for our daughter, we ended up using a sperm donor, right? Because, they're just, I didn't want to risk it because, a lot of my friends that have TS, their families substantially get worse over time, right? So I just didn't want to take the risk. But it was the best decision I ever made, is having, using a donor, because I have an amazingly healthy daughter who's doing great. So, you know, if you ever want to talk to me about it too, I've had to have the conversation even with my daughter. Like I waited until she was a little older to explain what we did and why we did it. You know, I tried to bring her around people that also used sperm donors and stuff, just so that she could kind of get an understanding of what had happened. So. The other thing is I just wanted to thank all of you as well for the panel, because I think this is a topic, you know, sexuality, we need to move to a sex positive environment, right? I mean, I think what we, I think we, you know, our culture is wrapped around just a taboo, and I think we need to change that, right? I mean, think about it, that's why we're all here. Someone had sex, and
right. Really?
Correct.
Oh my God. Yeah. I didn't know that.
So I mean, we need to enjoy it and embrace it. And I think just, you know, the more we talk about it, and the more, you know, like again, I just cheers to all of you for being here, for having this discussion. It's great.
Thank you.
So I'm going to turn the mic over to my colleague Julie now, who I think has some important information on us. I would just like to underscore the thanks to the panel, and thanks to all of you for being so engaged in this important conversation.
Hi everyone. I'd also like to say thank you so much. This has been incredible, and I love that we're doing these types of conversations that should not be taboo, and it's really insightful, and the challenges and for the advocacy for equitable and reproductive health care are so important, not even just for the rare disease community, but so important for us to also take that and have that be a positive conversation. Thank you, Dr. Fynan, Andre, Esmeralda, and Taylor. Thank you for sharing your experiences with us today, and everybody else who's here as well. So it's time for our networking lunch back in the Sierra Ballroom. At this time, you can go grab your lunch from the buffet stations. They're in the exhibit area. All of the ingredients are clearly labeled for anyone with dietary restrictions, and we hope that you find something that meets your needs. If you have any dietary restrictions or you don't see something that you can eat, please notify one of the staff members at registration, and we'll make sure to get you food and get you all cleared so that you're all set. For those of you who registered for one of the community conversations, you should have gotten a sheet at the table where the t-shirts were that has a label for your lunch conversation. Those are in the ballroom where the breakfast conversations were. If you didn't select a community conversation topic, please find a seat at any of the open networking tables that are located in the back of the ballroom. You also have the wonderful community hub where there are tables and all of our nonprofit exhibitors and lots of resources there. So please make sure at some point today you check that space out. We hope. And the photo booth. And the photo booth. Yes.
Yes.
It's really cool, you guys. So make sure that you are, you know, if you have your lunch and you're trying to find your seat, NORD staff will be able to help you get situated. And we know that families might have different community conversations. If you're dividing and conquering, then we can make sure that you get over there and then you have a chance to come back together on different topics. That's awesome if you're looking to divide and conquer too. So you're gonna have time to reconnect after when we get back into the sessions. And one other thing, if you are registered for the Rare Impact Awards this evening, please make sure to pick up your tickets before 3 p.m. at the NORD booth. They're required for entry. Universal's really strict about this. You're also going to receive directions on how to get there and when to pick them up. So thank you for listening to my litany of lunch-related discussion topics and all of that. Done. Thank you so much, and have a great lunch.
Yeah, let's get a picture.
I'm just putting you to work, Gina.
I'm glad you're pleased.
Yeah. Please.
Because our comms team was like, go.
Good, how are you?
Do you want to go?
I was going in the front, but that's okay. That's okay.
Do you want to do it with the screen kind of next?
Yeah, should
Okay.
we over here?
Yeah.
Let's go over here.
So now you look like you're in a club. So let's go over here. Yeah, we can go over. You look like there's really one behind you.
Wait, move it out.
Move it out.
That way.
Like this.
Yes.
Shoes.
A fan base over
Oh,
here.
thank you. Do you want to? I don't know. Okay. You don't want to. But can I see you open the?
Yeah.